let's explore extensor tendons and talk about the anatomy of extensor tendons and some ways in which to treat it. So if you're an occupational therapist and you're working in hand therapy, you're going to see extensor tendons. And I often say extensor tendons expand beyond just like lacerations, but lacerations are some of the more common ones. Any kind of hand injuries, you're going to end up with a flexor tendon or extensor tendon issue because they get stuck. So let's go over some basic anatomy. And just like when it comes to flexor tendons, you have like the really long you have those long tendons, and then in extensors we have a bunch of little ones, right? So if you make a light fist and then you keep your PIP and DIPs tucked in and you go into MP extension, you're gonna see these little tendons pop up. This is your EDC, your extensor digiti communis, EDC, sorry. Almost forgot there for a second. And so anytime you're studying anatomy, one of my key things that I teach inside any of my programs is we don't need to understand anatomy like we did when we're in school. Remember, you're an OT already, you're a PT already. We're post-degree, you're an OT assistant, you're a PT assistant, you're post-degree. So what I want you to sort of think about is know where it starts and ends, right? So we keep it really simple. Origin insertion, but we don't have to be like that, like formal. Muscles start and end somewhere, and any joint that it crosses, it's going to affect, right? And then you want to know its job, its function, what does it do? So the EDC is an extensor tendon, and it starts in the elbow, it crosses the wrist, and it ends here, the ends of P1, and its main job is to extend the MP. Anywhere that it crosses, it will also extend, so it will also help with wrist extension. So when we're talking about extensor tendon injuries, your zones are going to be extremely key. So once you understand anatomy, and then you see lacerations or you see cuts or you see injuries, then you have an idea, oh my God, could that tendon have been injured, right? So the anatomy then goes into what we call the extensor hood. So anything up here is then divided from, I always describe like you have one big ponytail, right? From that ponytail, you take out like a chunk, that is going to be your central slip, right? So from this big tendon, you're gonna get a certain amount of that tendon. Now it's gonna come and become this tendon, and it's called the central slip, central tendon, right? Because it's a piece of that. Even though it's a piece of that, it's a small enough piece that if this tendon moves, it's not gonna affect this one so much, right? That understanding is fundamental in terms of understanding when you have a extensor tendon injury, why you need the kind of splints that you need, okay? So I can't go into all of it, but that is fundamental to understand because what kind of splint you make is determined by the type of injury. Now you can sit here and you can memorize everything. I'm a big believer if you understand concepts, memorization will become that much easier for you, right? It's going to make the understanding the anatomy, memorizing the anatomy, what it does, its job, and how it affects the joints, like all of that becomes much easier. Now, if you're a therapist and you want to become a certified hand therapist, understanding that's going to be really key. Understanding the bigger picture of things are going to be key. So you understand the injury, you understand the protocols, how you start moving them. Once you start developing some of those skills and you want to become a certified hand therapist, now we're going to go into detail. We're going to go into nuances of things. So for example, I just brushed over extensor hood. When you're really studying for the certified hand therapy exam, you're going to need to understand the details of the extensor hood. The extensor hood includes the lateral bands, the central slip, the sagittal bands, the ORL, like all the little other intricacies, right? You're going to have to know how that functions and how that works. Extensor tendon problems can cause things like boutonniere, can cause things like swan neck deformities. Within the swan neck deformity, there's different reasons why you have swan neck deformities. It's not always a mallet finger. So you have to really understand the difference to become a certified hand therapist. So usually when people come inside, like for example, when people come inside the mentorship program, the mentorship program is our month-to-month program. It's a subscription. We'll go over a particular topic of the month. So this month, for example, we're going over extensor tendons. We're going to go over not just the anatomy, but we're going to go over protocols, treatments, different treatment techniques that you can use. Once you have a handle on that, and you want to become a certified hand therapist, just knowing all of that will make studying to become a certified hand therapist that much easier, because then you're going to have to go into the nuances, into the details, like for example of a swan neck deformity, because people can have swan neck deformities not just from mallet fingers. Mallet fingers is just one type of an extensor tendon type of injury. Swan neck deformities can come from people who have central nervous system types of issues, where then the muscle imbalances pull at the joints in a particular way because of the spasticity, and then now you all of a sudden you have PIP, joint, instability, right? That's just one example. So yeah, if you want to come inside if you want to develop your clinical skills, like if you're looking to develop your clinical skills, come inside a community where the therapists are really interested in just learning and getting better and getting results for their patients. And I really encourage thinking outside the box, right? Because that's what really helps us to get better results for our patients. Check the link below. We're going to start diving into extensor tendons this month. Well, depending on when you see this, you can find out what we're doing for that month, but then we always discuss different cases. It doesn't matter what kind of case, we discuss all types of cases. So let's go back to the tendons, right? So we have one big tendon. We have two extra tendons that are here. That's indice and the digiti minimi, that allows us to use our pointer finger and bring this up like this, right? So I have two additional tendons. These two don't have additional tendons. But when you understand some of your anatomy, it helps you to understand your zones. So on the flexor side, I always say remember your numbers. The even numbers will help you. In the extensor tendons, if you remember the odd numbers, it's going to help you memorize. So DIP is 1, PIP is 3, MP is 5, right? So you have odd numbers, 1, 3, and 5. So in between, this is 2, this is 4, and then this is 6, right? This is 7, now down here we're 8. So it just allows you to, wherever you see a cut, you're going to be like, oh, what tendons are there? What structures are there? And then it can help you to think about what zone you're in too, because zones will help you to determine how to splint, where to splint, when you're allowed to start moving and things like that. So let's go into example. We're gonna do zone 5, just like one of the easier zones. So there is a protocol called the ICAM protocol. It's an early controlled active motion protocol, and it allows you to move that tendon much faster than you normally would on other tendons. Now, this ICAM protocol you can only use when you've cut one tendon. If you're cutting a bunch of tendons, if you have a crush injury, like, you can't use that protocol. If you have, I don't know, let's say a rupture, right? Tendons are really strong. They don't just rupture for no reason. Usually there's something happens that ruptures it. So if you have a rupture, maybe there's some underlying autoimmune disease that can cause some of the bones to get really sharp and over a period of time saw at that tendon, and then all of a sudden, boom, you're like, oh, it just ruptured. No, it might be because one of your patient had rheumatoid arthritis, right? So if you have those kind of things, then the ICAM protocol might not be the best protocol to pick. So understanding that also allows you to have a discussion with your referral sources, your doctors, the other therapists that you're working with, and then be like, think about what's the best for your patient, right? It has to be one tendon. So I had a guy. He actually came to me, like, this is years ago in the hospital, and it was the first time I used the ICAM protocol. And one of the surgeons, I still work with him to this day, he was like, "Oh, there's this protocol. I want to see if we can try it." And I was like, "Let's go." This was a roofer. And he was, it's the boss, he's down below, and he's like, "Oh, we need this, we need this." Some guy is on the top of the roof, sees a piece of glass, kicks it off the roof to clear it. That glass comes flying down, cut him right in the middle of the hand. Tendon falls. The finger falls. Cut a tendon. Such a random ass, accident. Anyway, the ICAM protocol requires a wrist support splint, right? A wrist support splint, and then what they back then called a yoke splint. And a yoke splint is what you now know as a relative motion splint. So you have to have both those. And what it does is, if you see the pen activity, when you have that yoke splint on, and you have to have it on correctly, when you go to make a fist, see how it doesn't stretch that extensor tendon all the way down? It stretches the other one, so it protects the one that was cut. And then it's going to protect the wrist, right? Because why? The EDC crosses the wrist. And so if you start moving the wrist too early, you're going to pull on that tendon and on that repair. So whatever tendon that whatever joint that tendon crossed now needs to be included, correct? So you want to make sure that you have a wrist support splint and then a yoke, and then it follows a very particular protocol where you start to allow active motion. That's the whole point, right? Early active motion. Start to do active motion, and then after so many weeks, you're gonna leave this on because of the tendon here. You can take the wrist one off, and you can start to do tenodesis motions, right? I got this guy, one tendon. I always get really complicated cases that are more than just one thing. So I was just so excited that this one came with one tendon. Now in my own clinic, I get cases that are even worse, but yeah, it was one tendon, and the guy came in, consistently. But patients will come consistently when they can see that they're getting results. And we got him started really early. No pushing, no pulling, we just did scar massage. We worked on the scar. We made sure that he was not swollen, not painful, wound was closed, worked on the scar, and then started his active motion, protected active motion, right? And then around 2.5, 3 weeks, I'm forgetting the exact thing, we started to do a little tenodesis without the wrist. He would still wear the splint at night, and then slowly but surely we were able to take that yoke out and then just do make sure we're doing more active, and then making sure we can bend the MPs, and then making sure from MP flexion you can touch into a wrist, because then you're now stretching it fully, and then you can tuck it in, right? And then we were working on isolated MP extension just to get that tendon gliding as well. So those are zone 5 can be a relatively easy zone, especially if it's not that complex. You have one tendon. I've worked with some EDCs that's multiple tendons. MPs were fractured as well. So now you're just adding more and more things to it. But you want to start with the simple understanding of anatomy, starting with some protocols and the zones, right? Anatomy and zones kind of go together. And then you understand protocols and then the treatments behind those protocols. And then you can move on into more and more complex things, right? So let me know if this helps you. But if you're interested in developing your clinical skills in the world of extensor tendons, come join me inside the mentorship program. This is great for OT assistants, OTs, CHTs, PTs. You're more than welcome to come in. I'm just looking for people who love to learn and love to get great results for their patients. Click the link below and you'll learn more about the program. All right. If you like videos like this, consider sharing with a friend. All right.